You are young, but you have all the teeth standing here and there in your mouth. What will you do? The colleagues or your peer group will call you as some names depending on your teeth. How disgusting it is. How we can correct it? Whether you are young or old, we can do orthodontics. What is orthodontics? Ortho means straight, or straightening the teeth in the right, or it is not just straightening, it's designing the tooth to stand where it should stand for each and individual person's face. You might be different, an American might be different, an Indian might be different. Depending on the facial structures, you need to put the tooth in the right position so that he can confidently smile, he or she can smile confidently. When it can be done? Most of the people think that you cannot do orthodontics after 20 years, 25 years, 30 years. No, it's not right. We can do orthodontics until when you have good teeth in your mouth. So that is what is orthodontics all about. You can correct it. Why you need to do orthodontics? It's not just for looking good. It's all about, even if your teeth are crowded, if it is very crowded, how can you brush it? You cannot go in between all the teeth and brush it if it is crowded. If it is well aligned, it is just like you putting all your books in one go into a shelf. If you have arranged it well, you can easily clean it, you can keep it well, and also you can take it out. Just like that, the teeth needs to be aligned so that you can brush it and keep it clean. Why you need to do that? Even if you have a small tooth which is just turned around, that will cause you have spaces in between, or you might even have food lodgement in between. You might think that, okay, I'm good at brushing, I can take it out. But someday you might just forget to do it. If you just forget to do it, you are comfortable with that food particle which is in between. So that food particles, after some days, you might be brushing every day, but you have forgotten that food particle. That might have caused you some irritation on the first day. Second day, you are very comfortable with that food particle in between that tooth. So it might end up with caries and problems like that. So it's very important that your teeth are well aligned so that you can brush it also. And moreover, the smile depends on where the tooth is. You should confidently smile wherever you are. Maybe you are a sales executive or a TV anchor. Whether you are just a normal wife or husband, you need to smile so that you impress each and every person you meet. It's just like you smile warmly to a person. It is so welcome for that person. Even if he is the worst enemy, if you just smile to them, they have to return a smile. So that is what is the beauty of smile. Why you do orthodontics? Because you can move the natural tooth to the right position. That is the beauty of orthodontics. And people are worried, okay, I have to put metal braces there. No, you don't have to go for metal braces. Yes, metal braces are cheaper, but you can go for ceramic braces wherein it looks just like the tooth. You don't even see where it has been put in. And even we have coated wires where the wires also are not seen. So that also can go for aesthetic. If you are really concerned about aesthetics, if you are really concerned, or if you are a TV anchor or a film actress, what you can do? You can just put all the braces inside the mouth so that nobody sees the brackets at all, and still you can get it corrected. So you have no choice to say that, oh, I don't have time. You don't have time, you have to come only once in 3 months or 6 months to get the orthodontics done. So you cannot say that you don't have time. If you say that, I am concerned about my aesthetics, I am in the modeling career or a anchoring career, that is also out, because you can do lingual orthodontics or invisible orthodontics or ceramic orthodontics, whichever is good for you. It's not the dentist who is deciding now, it's more of you to decide. And so you can do an orthodontics, whatever is your thing. The only thing is that whether you want it or not. So you have good orthodontics, even if it is a smaller thing, you go to the orthodontics, you can even correct it just by adjusting the size and shape of the tooth. That is also can be called as orthodontics. You don't need to even put a braces in. So all these things, why is it happening that you might think that, okay, and my father has a good teeth, my mother has a good teeth. Why is it happening that my teeth are coming forward, or why is it that all crowded? You might have inherited the bone pattern or the facial features from your father and the teeth features from your mother. That is why you might get, when it comes into it, that is why it just goes in here and there. But still, you can get it corrected and correct the size and shape of the tooth also. Along with orthodontics, you can smile beautifully and confidently. So there is no reason to say that I cannot go for orthodontics. At whatever age, up to 60 years or 70 years, if you have good natural teeth, you can still go for orthodontics. It is not an excuse for not doing orthodontics. What else we can do with orthodontics? Even if you have lost a teeth, and if the neighboring teeth has moved into that space, we can take the neighboring teeth back and put a proper tooth in between. If you can do orthodontics, that we do very often. If it has moved really far, so that we can put another tooth in between also. So there are various methods, various offers, various types of materials which can be put in your mouth to correct all the teeth into a straight and curved and the best position for your face, tailor-made, designed just for you. So never worry about orthodontics, and it has also become very painless using all the nitinol and all the newer alloys. You put in, you will not even feel the pain, or it is no more tightening. It is just like you put the machine like thing inside, it slowly pulls it. It's not one day you go tighten it and next 7 days you are crying over it, and then you go back 1 month afterwards, then you tighten it, you will get another week of horror. It is no more like that. It's all done in a very soft, it's all done in a newer materials have made it much more simpler for the dentist and much more painless for the patient. So get it done, have a good smile.